Hi, my name is Dr. Virdee, and this is part 2 of a 3-part series on micronutrients. Last week we talked about symptoms of micronutrient deficiencies, and next week we're going to be talking about things that you can do to increase micronutrient status in your body. But this week we're going to be talking about causes of micronutrient deficiencies. A lot of the times it's small, easily modifiable things that we're doing with our diet and lifestyle that are contributing to micronutrient deficiencies. One of the first common causes that I see is medications. So when we're taking a medication, it can either interfere with the absorption of nutrients, or it can require specific nutrients in order to be metabolized. My patients are on these medications. Their body just naturally requires more of these nutrients because of the daily demand placed on them to metabolize the medication. A good example is birth control pills. Birth control is basically low-dose hormones that women are given on a daily basis. And so our bodies need to metabolize these hormones every day. So as a result, these nutrients, in particular B6, B12, and folic acid, are needed for neurotransmitter production. And so people tend to feel anxious or depressed or fatigued when they don't have these nutrients on a regular basis. Interestingly enough, they're also correlated with PMS symptoms, especially when women have mood problems approaching their periods or they have really painful periods. Magnesium in particular can really help with reducing symptoms of muscle cramping and muscle pain. Another medication that I commonly see contributing to micronutrient deficiencies is acid blockers. People are often on acid blockers when they have symptoms of gastroesophageal reflux disease. And acid blockers, either H2 blockers or proton pump inhibitors, actually inhibit your body's ability to make stomach acid. You need stomach acid to absorb iron, zinc, calcium, and vitamin B12. So they often develop symptoms of reduced bone density due to decreased levels of calcium, or symptoms of anemia due to less iron. And anemia can cause symptoms of muscle fatigue, hair loss, and heart palpitations. If you think that you may be on a medication that's contributing to micronutrient deficiencies and you want to get off of them, definitely consult with the prescribing physician first. There are some medications that could actually be quite dangerous if you got off of without medical supervision. So the next thing that I commonly see causing micronutrient deficiencies is actually the foods that we're eating. So coffee and black tea are a prime example. They contain substances in them called tannins, which are what make them bitter and astringent in quality. And tannins can actually block the body from absorbing iron and zinc. What I see is patients who drink coffee and tea throughout the day sometimes develop iron deficiency anemia because they're not getting enough iron into their systems. And one of the big symptoms of iron deficiency anemia is fatigue. And so it can turn into this catch-22 of, oh, I'm feeling tired, I need coffee, and then you drink the coffee, but you're not actually getting any of the iron from the foods that you're eating. And so you're trying to treat the fatigue with the coffee or the tea, but not realizing that the fatigue is due to drinking too much coffee and tea and inhibiting your body's ability to absorb iron. I am of Indian descent, and a lot of the times I find that Indian women who are vegetarians and drink chai tea throughout the day do have iron deficiency anemia and fatigue symptoms related to it. So that's just an interesting cultural insight. So the next thing that I'm going to talk about is actually something that I feel really passionately about, because a lot of my friends are farmers or have been farmers at some point in their life. And it's about farming practices. So in the past, a lot of farmers would engage in repleting their soil of nutrients. And so they would do it through composting or rotating fields. And these days, farmers have an increased demand of creating bigger fruits and vegetables that are pesticide resistant. With the increased growth, a lot of the times the soil is left completely deficient in nutrients. And it's hard for farmers to keep up with repleting their soil. There are certain farmers that do engage in practices that replete their soil, and this is why I really do encourage people to go shop at local farmers markets and talk to their farmers about how they're able to enhance the nutrient status of the fruits and vegetables that they sell. There have actually been studies done comparing fruits and vegetables from the 1950s to fruits and vegetables of today, and they're finding that in particular they're lower in vitamin Z, phosphorus, calcium, and zinc. Unfortunately, in the 1950s there weren't a lot of studies done on the nutrient status of fruits and vegetables, but now that we're noticing this trend, I do think that a lot of studies will be continued. The last thing I'm going to talk about is digestive functioning itself. Our nervous system is composed of the sympathetic nervous system, which is the fight or flight stress response. And that's when you're on the go, working, meeting deadlines. And then you have the parasympathetic nervous system, which is also known as the rest and digest relaxation. And I highly suspect that nutrient deficiencies could be due to poor digestion because we're not supporting this parasympathetic part of our nervous system. Eating on the run, eating while you're driving to work, or eating in a rush because you have a deadline to meet can actually all contribute to malabsorption of nutrients. The digestive process is actually initiated from the moment that your nose smells food. That's when the mouth starts salivating, and as soon as you start chewing food is when the stomach starts to prepare for the entrance of food by secreting more stomach acid. And that increase of stomach acid actually activates digestive enzymes to be secreted into your small intestine. And so it's really just this cascading effect that starts from the moment you smell or even think about food. One of the things I recommend to my patients is to start modifying the way that they interact with food when they're eating their meals. Sitting down and really creating a de-stressing atmosphere for yourself where you can take time to taste your food and chew it properly, and then after you eat, just relaxing, taking a quick 5-minute walk, or having a really nice conversation with a friend. These are all activities that can help our body and digestive enzymes and digestive process happen more efficiently. So I hope you found this video interesting. If you have any questions or comments, be sure to leave them below. And I look forward to seeing you next week when we'll be talking about simple things that you can do to improve your micronutrient status.